You know that moment in the dental clinic. You've got that beautifully crafted crown, maybe a veneer or perhaps an inlay, and it's time for that final crucial step, cementing it.
Absolutely. It's fundamental to restorative work. And like everything in dentistry, we're always searching for better ways, aren't we?
Always. Better materials, stronger bonds, maybe techniques that save a bit of time or money, or even look better aesthetically.
Exactly. And one idea that's been floating around, gaining some traction, is using the composite resin we already have for fillings.
Right, the stuff we know well.
Yeah.
But simply preheating it
Mm.
and then using that as the cement instead of a dedicated resin cement. I mean, on the surface, it sounds pretty appealing, doesn't it?
It really does. You're familiar with the material. Maybe there are cost savings involved. Potentially it handles easier. But, the big question is always, does the science actually back it up?
Is it better?
Yeah.
Or even just as good as what we're currently using?
Yeah, that's precisely the core question a group of researchers wanted to tackle in a recent systematic review. They aimed to sort of cut through the chatter and see what the lab studies really showed.
And that systematic review is what we're diving deep into today. The article's title is Effectiveness of Prosthetic Cementation with Preheated Composite Resins, a Systematic Review.
And it was published in the Journal of Aesthetic and Restorative Dentistry. Their specific goal, their mission, if you like, was to analyze the lab literature out there and answer that question. How does cementing single prosthetic units with preheated composite resin stack up against using traditional resin cement?
Okay, so our mission now is to unpack what they found. What did they actually conclude from looking at those studies? And importantly, what are the key insights for you, maybe sitting there thinking about trying this?
Right. So to do this review, the authors were pretty rigorous. They followed established guidelines, specifically the PRISMA 2020 standards, and they searched multiple scientific databases.
And they were looking for very specific kinds of studies, yeah.
Very specific. This review focused only on laboratory articles. So no clinical trials in humans, which is an important point we should probably circle back to later.
Good point.
And the studies they included had to be evaluating the cementation of single-unit prostheses, your crowns, veneers, inlays, onlays, using these preheated composite resins.
Okay, so how many studies actually fit the bill?
Well, they started with a huge number, over 1,500 potentially relevant articles initially, but after screening titles, abstracts, and then reading the full papers, only 9 studies actually met all their strict criteria.
9 studies. That's not a huge number, really.
It's not massive, no. So the evidence they summarized comes from just these 9 specific lab studies. They did assess the quality, though, and generally found them to have a low risk of bias, which is good. It suggests the data within those individual studies is likely reliable.
Okay, so let's get into it. What did these 9 studies actually find? The review looked at different properties, right, comparing the preheated composites to the traditional cements.
Yeah, they broke it down into 2 main categories: mechanical properties and physicochemical properties.
Right, let's start with mechanical things like durability, strength. What did they look at there?
They looked at microhardness, different types of bond strength like microtensile and shear strength, and also the failure load, which is basically how much force the whole setup, the tooth cement restoration complex, can take before breaking.
Okay, critical stuff for longevity. So what was the verdict on strength? Was preheating better, worse, or?
Well, this is where things immediately get a bit complicated. The review highlights a major theme right away.
Yeah.
Heterogeneity.
Heterogeneity, meaning the studies didn't agree.
Exactly. The results were all over the place, basically. For microhardness, one study found no significant change when preheating. Okay.
Yeah.
For microtensile strength, another study found it was actually higher with preheated composites. That sounds potentially positive for the bond, right?
Yeah, that sounds good.
But then a different study looking at shear strength found no significant difference with preheating. And for failure load, how much it could withstand, the results were described as quite heterogeneous, quite varied across the studies that looked at it. Some found no change. One found it depended on the specific type of resin used.
So it's not a simple, yes, it's stronger, or no, it's weaker. The mechanical picture is, well, it's fuzzy.
That's a good way to put it, fuzzy. The review's conclusion on the mechanical side is pretty cautious. They say, based on these varied, sometimes conflicting lab results, it's just not possible to definitively state that preheating directly helps or harms the overall mechanical properties.
So other factors are probably playing a big role.
Seems likely. Things like which specific composite you use, how exactly you hit it, the temperature, the time, and your technique, they all seem to introduce a lot of variability into the results.
Right. That makes it tough to make a clinical call based just on strength right now. Okay, let's shift gears to the physicochemical properties. This is where we get into things like fit, looks, how the material sets up.
Yes, and this section, I think, contains maybe the most clinically significant finding, or at least the most potentially concerning one.
Oh, which property is that?
Marginal adaptation. How well the edge of the restoration fits against the tooth.
Okay. Absolutely fundamental. A bad fit there leads to all sorts of problems down the line.
Exactly. Microleakage, sensitivity, recurrent decay, gum issues.
Mm-hmm.
Ultimately, the restoration failing. It's non-negotiable, really.
So what did they find regarding marginal adaptation with preheated composites?
Well, this is where it gets really interesting and, like I said, potentially concerning from a clinical perspective. The review found that 2 of the included studies actually observed greater marginal discrepancy.
Greater discrepancy, meaning a worse fit.
Yes, a worse fit when using preheated composite resins compared to the traditional cements they were tested against.
Wow. Okay, that is significant. Did they suggest why that might happen?
The authors theorized it might be linked to the filler particles within the composite. Composites are packed with these particles for strength.
Right.
And how these particles behave and influence the material's flow when it's heated could potentially make it harder to get that super thin, precise cement layer you need for perfect marginal adaptation.
That makes sense. It relates to viscosity and film thickness then. You need low viscosity, low foam thickness for a good cement.
Absolutely. And guess what? The findings on viscosity and film thickness were
Let me guess.
heterogeneous.
You got it. Mixed again. Some studies did show a decrease in viscosity and film thickness with preheating, which should be good for marginal fit.
Okay, so some studies showed improvement there.
Right. But others found no significant change. There was one positive note here, though. A study using a preheated bulk fill resin specifically noted fewer pores or bubbles in the cement layer. That could be a plus.
Fewer voids is generally good. Okay, so marginal adaptation shows a potential red flag in some studies. Viscosity results are mixed. What about the look of it? Aesthetics. Color stability is huge, especially for thin restorations like veneers.
This is actually one area where the findings seemed a bit more positive, leaning in favor of preheating. Oh, really? How so?
2 studies specifically investigated color change over time, and they found that the preheated composite resins showed less color change compared to either non-preheated composites or the traditional cements they tested.
Oh, interesting. That's definitely promising for anterior work. Any idea why?
The article suggested a couple of reasons, maybe lower water absorption and solubility in the heated material, or possibly fewer tertiary amines left after curing. Those are known to cause discoloration over time.
Makes sense.
Although, again, just to keep it balanced, another study found no significant difference in color stability. So still some variation, but definitely a potentially positive trend there for aesthetics.
Okay. And the last big physicochemical property degree of conversion. Basically, how well does this stuff actually cure or polymerize when you heat it? Does heating mess that up?
This property actually showed the most consistency across the different studies. It was quite reassuring, actually.
Good. What did they find?
4 separate studies reported homogeneous findings here. Preheating did not significantly change the degree of conversion of the composite resins.
So it cures just as well whether you preheat it or not.
According to these lab tests, yes, that's a favorable outcome. It means the material seems to be polymerizing adequately, which is essential for its final properties.
Okay, so let's try and synthesize this before we get to the big clinical takeaways. We've got consistency, and it looks good for degree of conversion. That's a plus.
Right.
We see some promise, maybe a positive trend for color stability. Another potential plus, especially aesthetically. But for critical mechanical properties like strength and failure load, the picture is really fuzzy, heterogeneous, no clear answer.
Correct. Lots of variability.
And crucially, for marginal adaptation, that absolutely critical fit, while viscosity results are mixed, there are concerning findings in some studies suggesting a worse fit.
That's the crux of it, really. And that heterogeneity, that lack of agreement across studies, is something the review authors explicitly point out as a major limitation.
Because the studies weren't all done the same way.
Exactly. They use different composite materials, different ways of heating them, different temperatures, different times, varied study designs, different ways of measuring the outcomes.
It's like comparing apples and oranges almost.
To some extent, yes, it makes it incredibly difficult to pool the data and come up with one single clear answer for many of these properties. Plus, remember, there are only 9 studies in total. That's a relatively small evidence base to draw firm conclusions from.
Right. Okay, so given all that, the mixed results, the sometimes concerning findings, the limitations, what does this actually mean for you, the dentist out there who might be considering this technique?
Well, the article definitely acknowledges why this technique is appealing in the first place. The potential clinical benefits we mentioned earlier.
Like cost savings.
Reduced costs compared to some dedicated cements, yeah. The technical familiarity, you already know how composites handle. Potentially good working time.
Aesthetics too, maybe.
The wide range of shades available, plus that hint of improved color stability we saw, those are all strong motivators for a clinician.
They absolutely are, but
The clinical implications section of the review itself is quite direct and, I'd say, quite cautious. Their bottom line, based only on the current available laboratory evidence summarized here, is this. It is not possible to confirm that cementing single prosthetic units with preheated composite resin is better than using traditional cements.
okay. That's a really important takeaway for clinical decisions. It's
Yeah.
not saying go for it or definitely don't. It's saying, look, the science we have right now doesn't prove it's superior.
Precisely. And for any clinician, that finding about greater marginal discrepancy in a couple of studies,
Yeah.
that has to be seen as a significant potential red flag.
Because marginal fit is just
Terrifying.
fundamental.
It's non-negotiable for long-term success. You absolutely have to weigh that potential risk, the risk of a compromised marginal seal against any perceived benefits in cost or handling or aesthetics.
So even though the idea sounds good, and some lab results look okay or even promising, that fundamental requirement of a perfect marginal seal seems potentially shaky based on some of this evidence.
That's really the key message from this review for the practicing dentist, I think. The lack of standardized protocols, exactly how hot, for how long, for which specific material combined with this inconsistent data on critical properties like strength and especially marginal adaptation. It means there just isn't a robust evidence base yet to recommend this technique as definitively superior or maybe even consistently equivalent across all situations compared to the established methods we already use.
So the concept might hold promise, but based on this systematic review of lab studies, we're just not quite there yet in terms of solid proof.
Not definitively, no. The article does conclude on a slightly more optimistic note for the future, though. They state that despite the current limitations and the clear need for more research, using preheated composites for cementation does offer, and I quote, excellent future promise.
Because it is convenient and has those potential advantages.
Right, but actually realizing that promise, that's going to require more research and probably better aligned research.
What kind of research do they suggest?
They specifically call out the need for studies looking at long-term clinical performance, which, remember, this review couldn't address as it only looked at lab studies.
Right. How does it hold up in actual patients over years?
Exactly. They also highlight needing to study surface properties like roughness and solubility right at that cement interface, things critical for gum health and long-term stability. And crucially, they suggest collaboration between researchers and the dental industry is really needed to establish standardized protocols.
So clinicians would actually know, for this composite, heat it to this temperature for this long if you're using it as a cement.
Precisely. Clear guidelines based on evidence.
Okay, so wrapping up this deep dive, the idea of preheating composite resin for cementation. It's appealing. Theoretical benefits in handling, cost, maybe aesthetics, maybe cure. But the current scientific evidence, as synthesized in this systematic review of lab studies, is really quite mixed. It's insufficient right now to definitively say it's better than traditional cements.
Yeah, you've got some promising aspects, color stability, degree of conversion seem okay or even good. But then you have these concerning findings, particularly the potential for worse marginal fit in some studies, and just widespread inconsistency in results for many key properties like strength.
So from your clinical perspective, listening to this, it means while the concept sounds good, the current evidence doesn't give a clear green light for widespread adoption as a proven, universally better technique.
That's right. You need to be aware of the potential risks highlighted here, like that compromised marginal adaptation possibility, and understand that the science hasn't yet standardized the process or consistently shown it's superior across the board.
It really brings it back to basics, doesn't it? Considering these findings, some good, some concerning, a lot still uncertain, what property do you think is the absolute non-negotiable must-have for any cementing agent you use? And thinking about that, how much solid evidence confirming that specific property would you need to see before you felt comfortable integrating a new technique like preheated composites into your daily practice?